Today we're going to talk about memory and the different types, but before you watch this video, you might want to check out my attention video because you need attention skills to absorb information before anything even gets in that you can store it and then retrieve it. So if you haven't already, go watch my attention video and come back to learn about different types of memory. We have many different types of memory: taste, smell, tactile, auditory, and visual. Each type of memory has a different location in the brain. For cognitive communication purposes, we are going to focus on visual and auditory memory. Visual information is stored in the right hemisphere of our brain, and verbal information, including what we've read, is stored in the left side of our brain. There are three stages to memory: working memory, where we hold on to information just long enough to perform some sort of action, as the name working suggests. Whether I give you a phone number and ask you to remember it long enough to be able to tell it to me backwards, or if I give you new information and ask you to make a decision or make a judgment call on it, that would be working memory. Working memory allows us to plan our thoughts, monitor our communicative attempts, and activate information stored in our long-term memory, those books that we have really nicely organized on our library shelves. We seek them out, our existing knowledge, and compare it to information that's coming in. For example, if you hear a news story and that reminds you of a similar story you read before. While working memory doesn't last for very long, it's a matter of minutes. In this article, we define short-term memory as something that you remember after a period of 30 minutes. After a brain injury, it's often short-term memory that gives people the biggest challenge. In this example, someone asks you to go to the grocery store and pick up some milk, eggs, newspaper, and dish soap, but by the time you get to the store, all that you remember is the milk. Long-term memory is information that we recall after a day, 2 weeks, or 10 years. For most people after a brain injury, long-term memory is preserved. After a brain injury, short-term memory isn't working, so information has a hard time getting to your long-term memory. It's difficult for your librarian to find the appropriate place and make sure that the book stays in that spot. For example, head-injured people may double or triple their usual study time when preparing for a test the next day. By the time they get to the exam, they are completely blank on the material. People with brain injury find that little events of the day are sometimes forgotten, making life fly by when you look back at events that have happened since the injury. Zooming into long memory in a little bit more detail, there are two different types of long-term memory. We have explicit memories, including semantic, which is knowledge of facts like birds have beaks. We have explicit episodic memory, which is where we remember things that have happened to us, like when I was 10, I broke my arm. Examples of implicit memory include procedural. For example, we remember how to brush our teeth without thinking about it too much. We have perceptual memory, so when asked, we would be able to generate some words that begin with cha. And we have simple associative memory, so we understand and recognize things like cause and effect. After a brain injury, creating new explicit memories can be challenging, so what we can do is use strategies that help us tap into implicit memory and turn explicit knowledge into implicit memory. That was your quick little overview of the different types of memory. Stay tuned for factors that impact memory, and then I'll teach you about external memory strategies and internal memory strategies that can be used to improve your memory in day-to-day tasks and conversations.